We're at Concept Cosmetic Medicine and I'm talking to Dr Phoebe today. We're going to have a chat about prevention rather than cure. Now, I'm a big fan of this concept. I think I've spent most of my time trying to prevent the ageing more so as I get older, but it is really important, and we know particularly from a young age, things such as sun damage, we really need to be protecting. So what are the key things?
So absolutely, prevention's better than cure. So if you start at a young age really looking after the skin and really thinking about how you're going to age, it'll definitely mean a lot less work later on and a lot less damage to undo. So if someone's sort of in their, 20s, for example, if they get on a good skincare regimen, that's so beneficial. Yeah. So the main key things to take away, and it doesn't have to cost a lot of money, these are cheap and cheerful tips that anyone can do.
Great.
So the first thing would be sunscreen every day. You've got to be so strict with it.
Yeah.
And I often hear from people who work in desk jobs, oh, well, I'm inside all day, I don't need to use it.
Yeah.
No, you absolutely need to be wearing sunscreen every day without fail, because they have done studies and of people who are office workers and they just go from the car to the office or pop out for a coffee and they think they're not getting any sun exposure or there's the sunlight coming in, but it actually, studies have shown it adds up to 3 full days.
Wow.
Now, you would never go and lie on the beach for three full days with nothing protecting your face, would you? But that's what you're doing. Okay. So that's why I insist that it just has to be automatic every day.
Okay, that's part of your routine.
So that's one of it.
We would also consider things such as creams at different ages. No doubt there's different types of creams that we use morning and night and so forth.
Absolutely. So look, I'm not too fussed about what cleanser and moisturiser people want to use. Whatever you like and whatever feels good is fine. I do think active ingredients are quite important. So I usually recommend for my patients who, don't want a complex routine is to just start by using a vitamin A derivative at night. So by that I mean, so over the counter you can get things with the word retinol in it or retinaldehyde. So they're a good place to start. And what they do is that they are topical exfoliants and they're also collagen stimulators. So what they do is they help to prevent lines, they thicken the skin over time, they clear pigmentation and help to smooth the texture. So it really is a really wonder ingredient.
Okay.
And then the step up from that, if you go to a doctor, is you can get the prescription form, which is a lot more effective. So the over-the-counter stuff is fine to start with.
Okay, excellent. Yeah. So from sort of younger age all the way through, we can consider those types
you can
of
do that
skincare.
at any age.
Okay.
Any age.
Sunscreen and a good moisturiser with potentially some vitamin A as well.
Absolutely.
All right, next level though, and this is where you come in, being a doctor here at CCM. Things such as those deeper wrinkles, and as we age, that kind of becomes a little bit more noticeable. Can we prevent that?
Absolutely. So I think that a good place to start if you just want to get your toe wet in the sort of cosmetic world is to start with anti-wrinkle injections. Okay. So a lot of people are worried about looking really stiff and fake, but if you maybe just start with one area. So if you're starting to get a deep crease in your frown line, that might be a good place to start, especially because if you let it go too long, that crease can become permanent and then it can be quite hard to get rid of. So that's a good one to start with that people aren't really going to notice. They'll just notice that maybe you look a little less cross or something like that.
Not frowning quite as much.
Exactly. So that might be a good one to start with. And then there's other areas in the upper face that are quite popular to do it all. But a good way to do it is to just start with one area and just do it slowly.
Okay, so the idea is if you're getting the anti-wrinkle injections, then hopefully you're not using those muscles as much.
Exactly.
Which means that we're going to lessen the look of those lines over time as well.
Exactly, because the skin and the lines, they're not getting the constant force of the muscles creating those lines, so it certainly means that they'll be less deep over time.
And then for those of us who have already aged and perhaps have a little more of those creases and lines that we maybe don't really want to have there so much. What are the areas we can actually treat with anti-wrinkles?
So look, it's never too late to start, firstly.
Right.
So people, regardless of their age, if you just start with the skincare and the anti-wrinkle injections, you will still notice a difference. It might just take a few more treatments to see those lines go away
Okay.
completely.
Yeah.
And then you also might need to incorporate some other treatments as well,
Right.
you know, like lasers or, you know, some fillers or something like that to help get rid of those lines. Now, I think your question was mainly about areas that we can
Areas, yeah,
treat.
what can we do?
So, yeah, so look, we can do the forehead, we can do the crow's feet, we can do the bunny lines. The lower face is getting quite
Yes.
popular, especially in women sort of in their 40s or older. So, you know, if you're getting the sad sort of
Yes, the lines
the
running
sad
down here.
the sad sort of face, you can kind of kick up that muscle so it looks a little bit less sad.
Yeah.
You can also make your jawline a little bit more prominent by doing a bit of putting a bit of tox along the jawline.
Okay.
The bands here can
Ooh,
become
yes,
quite
the
prominent.
necks.
Yeah, so you can even put a little bit in those to paralyse
Okay.
those a little bit to just make the neck look a little bit tighter.
Okay.
So yeah,
So
there's
there's
lots of
something for
things.
everyone,
There
isn't it?
there is,
And I
definitely.
guess the key is that if people are a little bit fearful, not really sure what they want, that they can come and have a consultation
Yeah,
with you.
look, absolutely. Like, fear is definitely a huge barrier for people to get over.
Yeah.
Definitely have a lot of people that are a bit needle phobic, or you know they've seen bad work on the street, and unfortunately it's often the bad work that you see and you think, I don't want to look like that, I don't want to look stiff,
Yeah.
I don't want to look overfilled. But I think when it's done well, it shouldn't really be easily detectable.
Yeah.
So that's sort of what our goal is.
Yes, and that's the key
Yeah.
to CCM, that you're all
Yeah,
doctors here.
absolutely,
We have our-
absolutely.
our
And
professional
we-
standards.
Yes, exactly. And we'd prefer to underdo things than overdo
Yeah.
things, if anything. So if you're fearful, we can certainly give you a dose that might be almost a little bit homeopathic,
Yes.
and then you can have the chance to come back and have more if you want.
All right, and
Yeah.
you have all the services available here as well. So thank
Yeah,
you so
we
much for
do.
filling
Thank
this
you,
in.
Roz.
It was great to chat to you.
Thank
if you'd
you.
like some more information, you can go to conceptcosmeticmedicine.com.au.